So the CQC. So we had our last inspection in December 2023.
We did.
The only home care provider in Trafford rated as outstanding. They monitor our service. Just because you have an inspection report doesn't mean to say that they don't monitor the service.
No.
They monitor the service on a monthly basis by a lot of things that we don't know what they actually do. The only thing we do know is that they speak to our clients to see if the service is okay.
Yeah. Well, the 5 key areas, isn't there?
Everything else is a mystery, yeah, those 5 key areas.
Yep, so the 5 key areas is safe. So is our service safe? It's effective. So is what we do effective on a day-to-day basis? Caring, are we caring? Well, we are caring. We're very, very caring. Are we responsive? So if somebody's care needs change, then we need to be able to change quickly with their care needs. So to be responsive, to be able to make those changes, and then well led. And I think we're all of those 5 things. I think we do outstandingly well. For us, it's always keeping on the front foot. You're always on the front foot. So we do spot checks with our carers. We do after visit spot checks. We do actual spot checks on their visits. So again, all those areas are really important to us that we remain outstanding. So we do our training in the office. So the training, we talk lots about clients. We talk lots about the training, about moving and handling, all of those things. CQC, when they're reading our notes, because now we're electronic, they can actually read our notes. So they can see by looking at our notes that 1, we're person-centred. 2, we're all of those 5 key areas that they're looking at by just using particular words that our carers use. By making somebody's support plan person-centred, it's as simple as it's actually the person's name. So you're not, one cap doesn't fit all. It's actually using that person as a person.
And just by you saying that, something's just occurred to me. Their approach is sort of multifaceted. So they come in and they dig up the drains, don't they? Basically, they look to see if your recruitment processes are robust. So are you getting references on potential new carers? Are you completing DBS checks for them?
Yeah.
Are you close to your clients' health and well-being?
Yeah.
Are you documenting everything? Have you got procedures in place for everything? Is your training good? Are you compliant with your training, both on an induction, on an ongoing basis and an annual basis?
We also have
is your equipment that you've got in the office safe and serviced?
Yeah.
Are you meeting outcomes for clients? Are you actually delivering what you say you're going to deliver in the initial care plan that we produce? Which
is changeable. We also have spreadsheets, so we have full spreadsheets. So if there's a pattern that our client is maybe experiencing falls for whatever reason, we can go back to the family and say, your mum had a fall here and here, even though we've been communicating with them. They can then contact the GPs and it may be something to do with medications. We have a weather spreadsheet, so if we have really terrible weather, we have a look and see if family members live close by. Our service may be a little bit later, so family members will then contact their families. So we have lots of different things to make us outstanding. It's not just, they come in and they look at our notes and that's the end of that. They look at everything around us.
And if they're doing an inspection, they turn up without announcement many times.
Yeah.
And we don't prompt the staff
or
the clients, so they speak to the staff for staff feedback. It's all anonymous. And speak to our clients and their families as well, which is, again, anonymous feedback.
I've also used the CQC for if I've had any queries. So the CQC aren't there to shut you down. The CQC are there. They're there to shut bad providers down. Providers.
They often don't do that immediately, but they put them on a plan. So there are how many ratings now? There's outstanding, there's good, requires improvement and inadequate.
Yeah.
I don't know the breakdowns, but I know that there's only less than 2% of all UK providers receive an outstanding rating. So it's quite rare.
Yeah.
Or very rare. So you have to be exceptional.
Yeah.
Your processes have to be really spot on.
And in order.
Yeah, your delivery has to be spot on. And your beliefs, your beliefs and your values have to be spot on.
I think if you're doing everything right and you're doing everything to an outstanding service, then you're not going to be surprised when they turn up on you.
And managing medication's a big thing as well.
Yeah.
You have to safely manage a person's medication.
Yeah, which staff get training for. And we're always on the other end of the phone. If any staff have issues or any worries while they're out with the clients, they can just ring us up and we can answer those questions for them. Which again, that leads us down to being well led. And I think the CQC, that they're also there for guidance. I've rang them on a couple of occasions for guidance, and I think they've, led us in the right path, really.
Yeah, especially on legislative changes.
Yeah. So that's about us at Beloved Homecare.
So if there's anyone out there, any families that are struggling with a loved one, I understand to a certain extent what you're going through. I've been through it myself before. Just get in touch. Give me a ring or Wendy a ring on 0161 711 0750 or email me, mark@belovedhomecare.co.uk. Doesn't matter where the scenario ends up, whether you come with us or not, really doesn't matter. Here to help. Dementia's really close to our hearts. We've both been touched by it in our families, so we're here to help.
Thank you.